Give us a sense right now. You have so many facilities. You treat so many people. What is the rate of vaccination in your facilities right now? How many people are you vaccinating a day, do you estimate?
Right now we're vaccinating about 3,000 or 4,000 a day, but we have the capacity to vaccinate between 10 and 20,000 people a day. That's the issue of supply now. The infrastructures are in place. The process is organized, and it is efficient and productive. So now the big issue will be the supply of the vaccine. As I said, if I had the supply, I can do between 10 and 20,000 vaccinations per day. And so can other large health systems in New York. I had a discussion this morning with other large health systems, and they are equally prepared. So the supply is the issue at the moment.
So on that issue of supply, there are those, as you well know, who say, let's not hold off on the second dose. Right now, as I understand it, if I get a first dose, you're going to hold a second dose and not give it to somebody else because you want to make sure it's there for me when I need to have it. What do you think of the proposal that, in fact, we can go ahead and use some of those second doses because we know more production is coming online?
I have no problem with that as long as we are able to be guaranteed that the second dose will be available. I think it's a mistake to give the first dose and then not be able to give the second dose. I just don't believe the science is there to demonstrate that by just getting the first dose that you will have the immunity that will last. We don't even know exactly the degree of the immunity after the first dose. So what we're doing in our health system and what other places are doing in New York is that when I get an allocation, I reserve for the second dose. So I put doses aside so I know for sure if there is a problem on the supply side, on the supply chain with the federal government, that I at least have enough doses for the second dose. We have actually, vaccinated right now over 60,000 people. And we are on, we'll have a projection to be able to do an awful lot more. But I do believe that it's important to reserve for the second dose.
So is help on the way as you look at it right now? Do you see more supply coming online or do they still have real supply problems?
I believe that more supply is coming online. Two reasons. One, obviously, President-elect Biden has indicated that he's going to release a lot more of the stockpile at the federal level. And so did Secretary Azar yesterday. So I do believe that will be coming. I don't know the level of the production on the manufacturing end with the pharma companies to see what level, where they are with that. I don't know that. And also the other thing is that there are other vaccines like Johnson & Johnson, which is a one-dose vaccine. The expectation is, from what I understand, is that might get to the FTC in the next 4 or 5 weeks for approval. If that happens, that increases the production. And having a one-dose vaccine makes life an awful lot easier than having to organize to do 2 doses. So I do think over time this will get better. And again, I think it's important for Bill to be a little bit patient here and to be optimistic. We will get to vaccinate everybody. It will happen. It will take multiple months, as we have been saying forever. But everybody gets a little bit hysterical. Everybody wants to be in the front of the line. We're inundated with everybody saying, well, I want to be first, and my situation is more important than everybody else. That's all understandable, fully understand it, but people have to be a little bit patient. We will get it, and we will get it done. And I do hope that the production of the vaccine increases and we get more supply. Supply. That is the issue at the moment.
What percentage of your healthcare workers at Northwell have been vaccinated so far? And are you meeting any resistance? Are there any employees saying, I really am not comfortable with it?
Right. Well, right now we have about 60% of our employees, about 55% of our employees have been vaccinated. I mean, obviously, we focused in on the staffs that have direct patient contact. That's the priority, and that's appropriate. We don't know yet for sure what the resistance rate is. That will become a lot more obvious going forward. We do know the following. We do know, for example, that lower income employees, minority employees are a little bit more hesitant. And that's understandable given the history in the minority community with the use of vaccines over time. And we're working on that deliberately at the moment just to make sure that we can communicate. And obviously, a lot of people are waiting to see the results of the first batch of people who get the vaccines, to see what the side effects are like, and we've had hardly any negative side effects at all. So I think as time goes on, people see other people getting it, realize that the side effects are very, very mild, that they say, okay, if you get it, I'm going to get it. And see the doctors getting it, you'll see the other staff getting it. So I do believe at the end of the day that there will be a portion of the population in every organization and in the public that will probably not get it. But if you get to 80% overall of people getting it, you have a pretty good herd immunity at that point. You're not going to get 100% on anything for that matter.
Right.
But if we get to 70, 80%, I think we'll be doing well. And I believe we will get to that point.
Just finally, Mr. Dowling, I want to ask a business question. Because you run a very big healthcare facility, but also a very large business. And there seemed to be a little bit of a distance between you and Governor Cuomo, who called upon the state hospitals not to be suing for back overdue medical bills. But Northwell, as a private institution, decided they would go ahead. Explain your thinking on that.
Well, yeah, but this is misunderstood, and a lot of the information is not correct that has been out there. Let me start with the principle. First of all, if there is a person that has the means to pay, and these are the only people that we have pursued in the past with any legal action. But if you have the means to pay, which means you have to have income above $140,000 a year, and then you have the obligation to pay, but you also have the obligation to communicate with us. So if you fail to communicate with us, completely ignore us completely, and you have the resources and we can demonstrate it, then I do think that it is appropriate to take some action against you, because it's not fair that all of the other people that are paying, it's not fair to them that you decide that you're going to just, forget your obligation. Now, back to the facts on the situation. All during COVID, we did not take any legal action against anybody. Most of the cases were from 2019 and 18. That was one of our hospitals that is a relatively new addition to our health system, and that our back office functions were not fully integrated. And yes, that hospital did, during COVID, take some actions. We regret that. It shouldn't have happened, and we have stopped that completely. So there will be no legal action taken against anybody for the duration of COVID in any one of our facilities going forward. But the fundamental principle, however, is still important. Right. If you can afford to pay, you should pay. It's not fair to others. At least contribute something toward it.